Duncan Wood. I am the director of the Mexico Institute at the Woodrow Wilson Center in Washington. Welcome to my basement in my house, and welcome to the homes or offices of our panelists. It's great to have you with us. Yes, somebody's just chatted in. Muffin sounds good right now. Yes, I hope you're able to get something delivered to your house, because believe me, I'm not going to bake it for you. Our event today is focused on the pandemic in Mexico, and really to get an idea of the, as the subtitle of the report from Signos Vitales says, the scope of the tragedy. It is a great delight for me to have with us three very distinguished panelists who will be able to talk about different dimensions of the pandemic. And let me just do a brief introduction of all three of our panelists today before I talk a little bit about the project itself. Valeria Moy. Valeria, welcome to our event. She is the director of IMCO, relatively newly minted as the director of IMCO, which is, of course, the Mexican Institute for Competitiveness, which has been a Mexican think tank that we at the Wilson Center have worked with for many years. Before her current position, she served as the director of Mexico Como Vamos, a prestigious economic policy think tank, another organization that has been a great delight to follow and to collaborate with. Previously, she worked at Mexico's National Banking and Securities Commission, the CNBV, focusing on regulation in the areas of development and economic studies, as well as markets and stock exchange supervision. Valeria was the Treasury Director at National Provincial Group, Mexico's largest insurance company. Since 2001, she has been a professor at the ITAM in Mexico City, and the Interactive Museum of Economics, the MIDE. Valeria is also a weekly columnist at news outlet Milenio, focusing on economic matters, and is frequently interviewed on television, radio, and print publications in both national and international media. In 2018, Forbes named her as one of the 100 most powerful women in Mexico, and that's why I'm frightened of her. Our second panelist, Eduardo Gonzalez Pierre, is a longtime collaborator with the Wilson Center. He is a global fellow with the Mexico Institute and a non-resident fellow at the Center for Global Development, also here in Washington. For more than 20 years, he's held senior positions in the health and social security sectors in Mexico. Most recently, Eduardo served as Deputy Minister of Health. Previously, he was the Executive Chairman of FunSalud, and he is currently working with FunSalud again, a leading health policy think tank. Chief Financial Officer and Planning Coordinator of the Mexican Institute of Social Security, the IMSS, largest provider of pensions and health services in Mexico. And he was also the chief economist there. He has also been general coordinator of strategic planning at the Ministry of Health. He's actively participated in the design, approval, and implementation of strategic social security and health financing legal reforms, such as the pension system reform and the introduction of the social protection in health, the Seguro Popular de Salud. He's also served as an advisor to the IMF, the World Bank, and currently to the World Health Organization, has published on a wide range of health, social protection, and social security topics. Eduardo holds a Bachelor of Science from Washington and Lee University and a PhD in economics from the University of Chicago. Eduardo, let me just say publicly, it is such a great pleasure to have you as a colleague. We are deeply grateful for all the things that you do for the Mexico Institute and to help us to understand the direction of health policy in Mexico. Lastly, but by no means least, let me introduce to you Enrique Cardenas. Enrique is the president of Signos Vitales, our co-host organization in this event, and of course the founder of the document that we're discussing. He's an economist from the ITAM with a master's and PhD in economics from Yale University. He was a professor of economic history for 20 years at the Universidad de las Americas Puebla. From then until the present day, he's taught classes in the areas of economic history and contemporary economics in Mexico, Latin America, and the United States. He's also been a visiting professor at the Colegio de Mexico, ITAM, CIDE, the Iberoamericana Santa Fe, and at the universities of Brown, Texas Christian, and Oxford St. Anthony's College. He's published articles and books in Mexico and abroad on these same topics. He's a member of the National System of Researchers, the SNI, Level 3. His latest book is called The Long Course of the Mexican Economy from 1780 to the Present Day, published by the Fondo de Cultura Económica in 2015. In 1995, he was appointed director at the Universidad de las Americas Puebla, a position he held until 2001. From 2001 to 2004, he was visiting professor at the University of Oxford in England and later at CIDE in Mexico. From 2005 to 2017, He served as executive director of the Centro de Estudios Espinosa Iglesias in Mexico City, where I first met Enrique. He was kind enough to invite me to participate in some of their projects, and he's currently a researcher at the Universidad Iberoamericana of Puebla. Enrique, welcome. Thank you for both being here with us and also for inviting me to participate with you in Signos Vitales. It's a great honor for me to be on the board of that organization. Full transparency, I'm an active collaborator with that, with Signos Vitales, and it's a great pleasure to do that. And let me just say something that what excites me about the project of Signos Vitales, and I'm going to ask you to lead us off in the discussion here by describing what Signos Vitales is all about, and then to talk about this report in particular. But what excites me is that this is really an attempt to create impartial, non-partisan information for the Mexican public, to provide unbiased analysis of the current situation in the country. And it's not always easy to do. Here at the Mexico Institute, at the Wilson Center, of course, our mandate from the US Congress is to be non-partisan. We have to be, because otherwise our funding would disappear. But it's not always easy. There are temptations to be pulled in different directions. And so I really do admire this attempt on the part of Signos Vitales and of yourself to put together this non-partisan analysis. I think it's vitally important if we're to find a way out of this crisis and obviously a way forward for Mexico in terms of development. With that, I'm going to pass the microphone over to Enrique to talk to us about the project and in particular about this report. Enrique, over to you.
Well, thank you very much, Duncan, and thank you very much to the Mexico Institute for the opportunity to address all of you and to be able to communicate what Signos Vitales is, vital signs, if you like. This is a new organization that we have developed because we began to find that there were too many fake news. True information was disappearing from public sources. Some institutions were cut off in their budget, like the Statistics Institute in Mexico. So they cannot do as many surveys as they used to. And even institutions were canceled, which were producing very, very important information, for instance, in education. So the goal, as Duncan just mentioned, is to present non-partisan, as objective as possible, a diagnosis of the country, not only in economics but also in the social areas, governance, and as well as, of course, I would say the environment and so on. Whatever needs to be done about the country, we will be presenting. And so this organization is really very very grateful to a lot of people who are joining, like Duncan, in order to collaborate. And also Eduardo and Valeria here are also members of that advisory committee who really let us, tell us what's going on and what kind of information is very important that we should, for instance, present. So that's the idea. And if you let me, I will go on to present the report on the pandemic. I will go into my presentation very, very quickly, but I will take advantage of that in the sense that here are the names of the members of the specializing, the Specialist Advisory Committee and the Executive Committee. You will probably recognize many of those names as you will see the strength of the institution. It's really due to them. So we are very grateful for their involvement and their participation on this area. So now to the report. The report has this content. Of course, we are going to talk about the pandemic, how was the response and the government narrative that was carried out at the beginning, but who were the first victims? Then we'll talk about a little bit about the health strategy, the economic strategy, just very succinctly. You can look at the report. It's in English, actually, and also executive summarize can also be consulted. We will also talk about the health impact of the pandemic, the economic and the social impacts as well, and a little bit about the picture as we were looking at it. We presented the report after, about 4 weeks ago, And so some of the figures have changed, of course, but I will try to update them for you. So first, the response and the narrative. The government's initial response was to downplay the COVID pandemic. So neither the health system nor the economy, the population were prepared really for the disease. And there was a lack of coordination with the states in the country since the beginning. It actually took 20 days to establish the General Health Council after the first contagion. And then it had a very difficult evolution. This was to be, the highest authority on the issue. The first victims were medical and health personnel. As of June 16th, now we have a bit more recent figures, but as of June 16th, 21% of infections were from medical and health personnel, and 2.6% of total deaths were from medical and health personnel. It's a very high figure. Today, it seems to be that it has come down to 2.1, but of course the number of deaths has increased tremendously in those days. So just as comparison, you can see how that looks, comparing it with the US, with China, United Kingdom, 4 or 5 times higher in Mexico than it is in those countries, double than Brazil, and about 3 times more than Peru. What was the narrative? There were conflicting messages between the president and the Ministry of Health. The president underestimates the danger and consequences on the one hand, and the Ministry of Health recommends protection that are not really being followed by the president or by public policy in general. On the right, you see a brochure that was published by the government. So you can tell, it's a real brochure, of course in Spanish, but nevertheless, you can be struck by it, I think. So it shows, I think, what I'm trying to say. Now, what was the health strategy? First, it was a monitoring of the pandemic was done by the Sentinel model. Of course, Eduardo can mention much more about this. I will be very succinct, which is limited and unrepresentative sampling, which gave you an idea of the problem, but was not really helpful in order to contain the contagion that was taking place. There were very few tests, and continues to be very few tests, about 6,100, 6,200 tests per million inhabitants against 130, 150, even 200,000 tests sometimes in some countries per million inhabitants. And then, of course, the deaths, as in many other countries, but here is the figure for Mexico City, which was corroborated by the government many months later on the amount of deaths compared to the registered deaths of COVID. And although it is known that everywhere there is an under registry of deaths, what the data that we have found with researchers that have been doing this work is that by the end of by the end of July, we have an excess mortality of about 3 times that number compared to the registered confirmed deaths of COVID. So the number of 57,000 or even 58,000 deaths as today should be multiplied by 3 and a bit in order to find out what is the excess of deaths of this year compared to the average of the previous 4 years. So the projections are that we will have 88,000 deaths by the beginning of October. The number of cases continues to be very high. The pandemic is out of control and the health scenario is quite unfortunate. So still in those conditions, the authorities and the government ended social distancing and on May 28, they announced the return to the new normality where the whole country was almost on a red traffic light. So it was not actually, something that people were looking for, but of course the economic situation was very difficult at that time already. Let me talk a little bit about then the economic strategy. Their economic policy in other countries was ignored. Mexico came out, as in the US, later in the pandemic. We had 2 months to prepare. And But the government just didn't follow what other countries were doing. Almost no support. There continues to exist, they continue to exist in social programs, which are not really related to the job market, for instance. They are headed to young people and to very old people. And there was a reduction in public spending. The business sector were trying to do something, trying to revive the economy. They got a deal with the Inter-American Development Bank, Invest, to grant some money, some credits, but the government neither provided emergency and temporary income to poor families for keeping social distancing possible, especially in the informal sector, which is so large in the country. And there was no significant support to protect employment or companies. There were numerous proposals from the private sector, from research centers, universities, political parties, and prominent individuals from all sorts of the ideological continuum. And there was really no answer to that. It continues to have no answer. So what we see is that GDP, the forecast is to fall more than 8% this year, probably 10. Some institutes already place it there. As you know, in other countries, it's quite different. The sort of support in terms of GDP, well, you can see Mexico, you need to have a microscope to get to that graph. But yes, there was very, very little, very modest and very late and insufficient help. So support is much less than 1% of GDP, while other countries provided much more. I won't stop in specifics on that support because it's very small anyway. But what I want to make, the point I want to make is that social distancing measures were not applied on a timely fashion and neither in a strict manner. There was no proliferation, the proliferation of infections was not prevented. That it was considered that social distancing would undermine the economic activity. So, making people stay at home, they said that would, harm the economic activity. And so they belated that as much as they could. The government at the same time refused to give people an emergency modest income to stay home. And without that sustenance, it was impossible for millions of people to strictly observe social distancing. When that happened, that was in the third week of March and all the way through April, people had to stay home without getting any money. And so the government fell into this trap of the false dilemma, economics versus health, I think. And it has been caught on that. Instead of thinking that we have to contain and then little by little open up, but providing some income for these families, that would be the way to go as it was in many other countries, especially containing the crisis. So what was the impact in April and May? A very big jump in unemployment, on occupation. Now the figures for June and July have just been presented yesterday or the day before yesterday by this survey done by a university and a research institute, well respected. They have come down because people have begun to go out, but the problem is that the income they are earning is much lower than they were earning before. So not only unemployment is still high, but also the income levels that they are getting is very low. If you look at the informal sector, you see that in terms of the worst people hit is women, and especially in the informal sector, 22% of unemployment rate, and then of course in the formal sector as well. Well, what are the results of this? What are the results? In May, we had 12 million people that had lost their income. Imagine, 12 million people lost their income. And the loss was approximately 65%. That has changed now. That's a bit less than that. Now it's 50%, but still very high. 9% more households than in 2018 have severe or moderate food insecurity. That number has been increasing a little bit in the last month or two, according to the last report 2 days ago. There will be between 6 and almost 11 million more people in extreme poverty. And in June, July, the occupation rate has improved slightly, but as I said, income has not. So there will be over 4 million people more young people who neither work or study without job. 12.2 million members of the middle class will fall into poverty. And by the end of 2020, the estimates back in May, now we need to look again at the estimates, but it will be very, very much higher than it was last year. So gender violence has also increased 27% in the first 4 months of the year, 27%. And with that, other problems with delinquency. The problem also is in health. About a third of all individuals 18 years old or older have some symptoms of depression. 80% of households with children or adolescents reported problems to continue with education. That's a long-term impact that we will have to face. And the problem of that was especially the lack of the computer equipment or access to internet in about half. We're starting the new year, academic year, and we are seeing that that has been transformed to television, but that's not going to be properly, that's not going to be very effective, I don't think. Then 16% more dropouts from high school due to the increase in poverty are expected. So what we are looking at, of course, is inequality, more inequality and more obstacles to social mobility. So what we are foreseeing in the next future is a very lost decade in the horizon, just like in the 80s, or maybe even worse than in the 80s. That is the scope of the tragedy, I would say. Duncan, I hope I kept more or less my time.
You did, absolutely. And you get bonus points for that. Thank you, Enrique. And obviously the report itself in Spanish is a much more detailed analysis of all of these points. We've had some questions already in the chat about whether we can share the PowerPoint that you've just shared. We'll put that up onto our website after the event. But most importantly, I would like everybody to look at the chat function here, and you can see the entire report. There's a link here that will take you to the Signos Vitales website. And not just this report, but also other reports, of course, that have come out from Signos Vitales. So I urge you all to do that. Enrique, thank you very much for giving us the overview of both the project and of this particular report. I'd like to go into greater depth right now and detail on the health questions with Eduardo Gonzalez Pierre. Eduardo, Enrique has given us an introduction there to the issues, but I'd love to hear your analysis of where we are in the trajectory of the pandemic at this moment.
Thank you, Duncan. I'll try to react to what Enrique has presented to us and many other findings. I want to first start by congratulating you, Duncan, the Wilson Center, the Mexico Institute, for putting this together, and also for Signos Vitales. I think Enrique and his team have done a wonderful job. I appreciate them, the invite for being part of the advisory committee. And in particular, I want to congratulate them for the vision. It seems that they anticipated a situation. They knew that there were going to be shortfalls in information. And I think they came in very timely in terms of the pandemic. I'm sure it's the case also for other types of information problems, but I think they've done a wonderful job in putting the information in light. And I think it's a matter of recognizing this type of work for the better of many things. I will try to react to this in terms of what can be done with this information, especially with the great effort that Enrique, Signos Vitales, INCO also have been doing. So I want to reflect on a different dimension of what we mean by tragedy. So I understand the concept of the tragedy. I think Enrique has been very eloquent in setting the numbers. I want to remind everybody that back in April, when the main spokesperson and strategic leader of the response for the pandemic, Dr. Hugo Lopez-Gatell, the undersecretary, mentioned his scenarios. He talked about 3,000 fatality cases. He then talked about maybe a bad scenario, about 15,000 deaths. And he did mention there was a catastrophic scenario that would reach 60,000 deaths. And I think we're on track on reaching 60,000 deaths by the weekend. we're around 58,000, which means we're reaching this catastrophic scenario. And if the IHME that Enrique mentioned, the projections are correct, we'll be reaching by October maybe 100,000. If on top of that you add the under reporting on excess mortality, it's important to understand that not all the excess mortality is COVID. Some of it is COVID, some of it is COVID related in the sense that it is not people that died from COVID complications, but people that died from delayed care associated to overwhelmed hospitals because of COVID. So I think we have to add all this together. But in any case, it is catastrophic. It is a real tragedy. But what I have in mind is another type of tragedy. And it is that it would be really, really shameful if this crisis would go to waste. What I mean by that is that all this is a very important learning experience. It has revealed things about the health system. It has revealed things about government. It has revealed many things have surfaced around our society. And what cannot happen is for all this information not to be translated into lessons, and the lessons be translated into future policy formulation. So I know that Signos Vitales doesn't have as part of its scope and mandate to work policy scenarios and recommendations around what to do, but I think it's unavoidable to start thinking about what all these numbers mean, and especially to avoid committing the same type of mistakes, or maybe understanding what went right. Let's be fair about this, and making sure that we learn from this. And I want to propose that it is important to put all this information to work for three important reasons. And let me mention these three reasons. Number one, and I don't want to be pessimistic, but I think everybody would agree this is not the last pandemic. Since the 2009 pandemic, we knew there was another one coming, and now we know there will be another one. It is actually possible that pandemics will increase in frequency just because of the global nature of exchanges, just because population growth and urbanization promote conditions for future pandemics. So I think it is important to learn and apply those learnings to new policies and preparedness, just because we might come up with a crisis like this in the future. And I think we have to make sure that we prepare for that. And I think we have to be on track, and I'll propose some specific things about this. Second reason why I think we have to put these numbers to work is because of an argument of reciprocity. I think Mexico has this dubious achievement of being the third country with the most deaths officially reported. Chances are it will probably match Brazil, let's hope not. But in any case, I think we're part of a global community, and what happens elsewhere in other countries, and I think we saw this as the first wave hit Asia and Europe, that we greatly benefit with knowing what was happening in other countries. And in that sense, I think we have to offer the Mexican experience of what happened in Mexico, the goods, the bads, and share that with the rest of the global community, so that we can be better prepared, not only as Mexico as a country, but also as a global community. So the pandemic in Mexico and the assessment of how we managed it is not only a Mexico concern, it is a global concern. And I think the third argument why we have to reflect on what comes next is because what Enrique's effort is about, and Signos Vitales, and what has been happening in the pandemic and the response from government, in the organizations and institutions, the political economy around the response, I think it's not limited to health. It has repercussions and learnings across sectors. It can happen in any other sector. So the learnings that might come out of this exercise, I think are applicable. They have externalities and the better working of government and society as a whole for the future. Now, let me summarize and maybe a brief explanation of things that had happened. I know there are no shared or consensus of what went right and what went wrong, but let me offer some of the takeaways on my side of what had been observed and what has happened. First of all, I agree with Enrique. The pandemic was originally downplayed. I think if you saw the slides of Enrique of how we portrayed the pandemic in the early days, it wasn't as critical as we know it is now. But I think a lot of that has to do with the Mexican experience in 2009 with the H1N1 pandemic. And for example, if you remember back then, one of the things that emerged from those times is that face masks and banning international travel were not to be recommended. It was something that was back then learned. And I think that because people at the Ministry of Health, most notably Dr. Hugo Lopez-Gatell, was part of that initial effort in 2009, he was conditioned with those learnings. So back to my main message, the future response of the next pandemic is conditioned by the experience we have had in this pandemic. And that's why it's so important is to understand and avoid future downplaying or overplaying of pandemics when they happen. Second of all, I do think we had these contradictory messages. I think it wasn't clear, people got confused. We were not the only country that were setting out contradictory messages. And I think that has a lot to do with two things. Number one is there was a lot of uncertainty about the information that was coming out. In fact, it is still coming in contradictory measures. We still don't know how the pandemic is transmitted, how the virus is transmitted. There's conflicting messages. Everybody's putting out in a clearinghouse the new evidence, but I think some of the messages are attributed to the nature of work of our government, but some of it has to do with just not knowing exactly what was happening. But there's important lessons learned around that. And I think we have to understand that central governments with good leadership do a good job with pandemics. They have other shortfalls, but at least in the Mexican setting with this federalist government and so many players in the decision-making, I think it is important to understand those limitations when the future comes. I think measures were improvised. And the biggest flaw, in my point of view, is that the politics got mixed with the science. Again, we're not the only country that did this, but I think we have to untangle and make sure that the politics and the science go side and side, but don't mix each other and contribute to the contradictions that we have been seeing. The fourth takeaway is that there was not a clear position on testing. There was not a clear position on the testing, and there was not a clear position on the contact tracing or the confinement tracking. So I think that has been one of the most important lessons and shortfalls of what has happened in Mexico. I don't think it's easy to respond to it, but it does show that we had some very important limitations in the response capacity, especially in the early times. Not that the pandemic has had such a widespread prevalence, it is very difficult to reinstall a testing, tracking, and tracing strategy. Two more takeaways on my side. The next one is that tensions that we knew were there surfaced, and some of the ones that had already surfaced increased. And I'm talking specifically about the tensions between federal government and local governments. I think that contributed to the confusion. I think we have to understand we live in a federalist country, and that creates very important lessons in terms of the response capacity and the performance of the health system in terms of responding to that. So Mexico has done maybe not so well in tackling this, but if you unfold this into the response state by state and locality by locality, it is very, very important how some experiences were very good, some were not as good, and we have a very rich environment in which to draw very valuable conclusions. And finally, I think it's very important that we look into not finally, there's another shortfall, which is important. And I think this pandemic revealed very important weaknesses of the health system. I think the health system was suffering before the pandemic. And what the pandemic did is it forced some shortfalls, for example, the procurement process. We knew there were problems there, but eventually when hospitals were found without personal protective equipment, the coordination around the agencies, the coordination around the levels of government, that was particularly important to see, and we shouldn't throw away those experiences for future sake. My last comment and takeaways has to do with something that Enrique stressed, and I think it's very, very important. And this is a very regressive pandemic. It was amazing how it hit the poorest the most. I don't think anybody saw that. And I think it has two sides to it. It hit the poorest on the health side, and it hit the poorest on the economic side. On the poorest side, because the infection rates were highest with the people that were more vulnerable, which means the poorest, the people that live in confined areas, and the people that use public transportation are more prone to get infected. And out of those that get infected, which are mostly the poor, the ones that do less well once hospitalized are also the poor because they have access to lower quality healthcare. So I think that worked on the health side. And in addition to that, the poor are the less likely to adapt to the new settings, to work on virtual modes. It is mostly the non-white collar population which cannot do what we're doing. And of course, those got hit the hardest in terms of income. So the safety net arrangements and the impact on the poor, I think was not foreseen. It was not something that we could prepare for, but it's something we could prepare for in the future. Now, what comes next, and I'll try to wrap up, is that the ball is rolling in terms of accountability processes and understanding what comes next. The WHO has already set in motion an independent assessment panel. Dr. Tedros, who is the Director General of WHO, announced this panel on the 9th of July. It is a panel that is chaired by the former Prime Minister of New Zealand and the former ex-president of Liberia, which is also a Nobel Prize winner. And they are understanding what went right, what went wrong for the WHO, which has been highly criticized also. And they will put forth these experiences and learnings for the rest of us to understand. This was launched in the last World Health Assembly in May. There will be an interim report in November, and there will be a full report next May when the World Health Assembly meets again. So we are coming into an environment, a process of understanding what happened at the global level, and I don't think we should stay distant from this. Spain has already put in motion this type of retrospective analysis. The 46 scientific societies in Spain have already asked for an independent review. Sweden has also recognized its shortfalls when it tried to tackle this as a controlled herd immunity strategy. And we were discussing just a few minutes ago, the United Kingdom has set in motion a big restructuring of its health system, starting with the restructuring of Public Health England, a very, very important institution in the United Kingdom, which is in charge of addressing pandemics like it did now. So I'll finish here. I'll wrap up, and I will finish where I started, which is the reflection that we should not just leave it at understanding the numbers and the degree of the tragedy. We have to move in terms of what to come next. One possibility is to expect that the government will do its own self-assessment, that maybe they will then come into a review of what went wrong and what went wrong. I think that will not be the case. And that's why I think that it's a very important message that civil society takes a very strong position and a very active um, strategy in terms of playing a role on this assessment of the handling of the response capacity and the strategies to tackle this. I think we have to congratulate the type of civil society organizations we have here, Signos Vitales, INCO, um, other institutions that have played an important role. But my feeling is that this is just starting. And I think, and I hope that there will be more to come. And I hope this will be the beginning of a very, very important learning process for all of us. Thank you, Duncan.
Thank you, Eduardo. And let me just say immediately that we'd love to take you up on your challenge to work on proposals on this. We'd be delighted to do it with both Signos Vitales and with IMCO if there's interest there. I think that the point you make at the end about the importance of civil society providing that kind of not just accountability but vision looking forward is very important. I'd like to thank all of our participants who have been sending in questions to the Q&A. If you haven't done so yet and you have a burning question you'd like to be answered by our panelists, when I say burning, I mean intellectually. If it's anything to do with health, we're not going to deal with that kind of burning on this particular panel, okay? But now to talk about the implications of the pandemic for the economy, I'd like to turn the microphone over to Valeria Moy. Valeria, it's yours.
Hi, Duncan. I really appreciate it. I really appreciate the invitation. It's a pleasure to be with Enrique and to be with Eduardo, whom I have learned so much from. I'm going to focus on the economic aspect of the pandemic. As Enrique and Eduardo were saying, I think we downplayed in Mexico, the government and the authorities, and even people, even society downplayed the epidemic. I remember going in March, at the beginning in March, to the banking convention in Acapulco, and I remember bankers laughing about the COVID. They said like, oh, come on, just with a shot of tequila, we will take care of it. So it's not only the government, we also downplay the pandemic, and I think that's taking a toll right now to us, to the country. Well, let me show you this. I'm sharing the screen. I hope everybody's able to see it. First of all, I want to stress that before the arrival of COVID-19 to Mexico, the national economy was not doing good. It was actually decreasing. It registered its first negative growth rate since 2009. And I remember at the end of last year, we were discussing, now it seems like so far away, but we were discussing if it was a recession or not. That this little number of 0.3 qualified as a recession, or maybe not, because it's not generalized and it's not in all the sectors. Now, of course, that discussion just like seems like a million years away, because we all agree that it's not only a recession. This is like the worst recession we have seen in probably 100 years. So we were badly prepared for the pandemic. So you can see the numbers here. It's the GDP growth since 1994. As you can remember, 1995 was a terrible year for Mexico. That's the worst crisis I remember. I was younger then, of course, as everybody here. But I remember the impact. I remember everybody feeling it. I remember my parents talking about it. It changed my possibilities of studying abroad. So this crisis, the one of 1995, was very severe for the population. It was very hardly hit. Then the one of 2009, it was felt differently, to be honest with you. Maybe the percentages were similar or not, but the way that people felt it, or the way that people perceived the crisis, was completely different. And in 2019, we got a first negative annual rate, 0.3, and it was a lost year in terms of economic growth. Now let me show you the numbers to the first quarter. This is the numbers, those are the numbers at the end of March. So at the end of March, please remember that we went into confinement at the end of March. So January and February were regular months, you can say, were normal months. We were starting to feel some of the impact of the closing of the manufacturer productive chains in the United States, but February wasn't that bad. The month that started to feel the impact of the pandemic was March, especially at the end of March. And given those numbers, the decrease in the economic activity in the first quarter was just, quote unquote, minus 2.2 at an annual rate. So that's what we're seeing. So when we got that number, we said, well, it wasn't that bad because we have a huge delay in the information. So when we received the number, it was, it doesn't look that bad. Again, once again, downplaying everything, not only the health issue, also the economic issue. At the end of March, at the beginning of April, maybe, those were the times where the government announced the fiscal policies that we would take as a country to make front to the pandemic. And we might be able to laugh if they were not tragic. The numbers, I know that Enrique showed a graph there, the numbers account for almost 0.4% of GDP as fiscal support. And not even if we stretch that number, those numbers haven't even gone to the full of the program, because one of the programs that was announced wasn't even implemented. So the number, this 0.4 that I'm talking about, includes that specific program if it had been wholly used, but it wasn't. So the real support, the real fiscal support, must amount right now at around 0.25% of GDP, which is basically, I mean, I wouldn't say it's nothing, but it's close to zero. So numbers are hard here. This is the second quarter. We still don't have the formal official number. We have the preliminary figure. The preliminary figure shows that the Mexican economy decreased or shrank by 18.9%, and this is year on year. That's an annual rate. According to the preliminary estimates, the real number will be given the following week. If we annualize that rate, that is, in order to be able to compare the rate of the United States as in the form that the United States presents the numbers, we should annualize this rate. If we annualize the rate, this minus 17 turns into minus 53%. So if we want to compare US numbers with Mexican numbers, we should take the annualized rates. We should compare apples to apples and pears to pears. So the American economy decreased or shrank by around 32% during the second trimester, during the second quarter. The Mexican economy in comparable figures shrank 53%. Of course, we have never seen in the history of Mexico, of the numbers of Mexico, of the national account system of Mexico, a decrease such as the one we saw on the second quarter. It was just amazing. I mean, I've never seen that, of course. And we're assuming that June wasn't that bad. And actually the numbers that we're having in other areas, not GDP, but in other variables, are a little bit better in June. So that's considering that June showed a little bit of improvement. This is the IGAI, what we call it in Mexico, the Global Economic Activity Indicator, that shows annual drops. It's like a proxy of GDP. It shows annual drops in April and May. And of course, those were the steepest ones on the register, and they were lower than the previous minimum. That was in October 95, the year that we were very, very much hit by the tequila crisis. So this is the last number we have. It's minus 21.6 during May. We're still waiting for the number in June. I think that June will show a little bit of a recovery, given that we have the estimate of the GDP. So that makes us think that the worst probably happened during April and May, at least in the economic arena. But bear in mind, this is exactly the same graph, but I'm just signaling or pointing in red how many months we were showing decreases in the IGAI. As you can see, there are like 13 months that the IGAI had been decreasing, and that's not common at all. Of course, we have some moments in time that IGAI decreases. Of course, here it's the crisis, the global economic financial crisis, but we usually are above zero. And when the pandemic hit, that was around here, we were showing 13 months in a row of decreases in IGAI. So that shows us that we were not in a very solid economic position to face this pandemic. And this is something that for me, it's like mind blowing. This is not the rates, these are the levels. So we are, what I'm showing here is that the IGAI, the production proxy, it's at the same level, or at least was in May, at exactly or very similar level of the one that we saw during September 2009. So when Enrique was saying that we're losing a decade, here it is. At least we lost a decade in production. We are at the same level of production as the one that we had in September 2009. For me, that's just like mind blowing, because of course, in those 11 years, population has increased, of course. So you can see the decrease here. Well, maybe you can see it because it's so steep that probably it's very difficult to take notice, but the last line, the last column is a blue one, and that's the decrease in the IGAI in May. Private consumption that usually doesn't decrease that much. What we saw during May and April were just numbers that, of course, we have never seen before. Private consumption fell 19.6 month on month in April and 1.7 in May. The indicator is 23.5 below May 2019 figures. We have never seen that. And of course, you can imagine that this hits the population severely. Of course, we can have an explanation for that. We can say, well, we were staying at home. We were not going to restaurants or traveling. And of course, private consumption decreases. That might be the case, but bear in mind that not the whole population stayed at home. Enrique was saying, Eduardo was saying as well, that the messages were very confusing. So maybe a sector of the population stayed at home, and a large part of the population, especially the ones that are working in the informal sector, didn't stay at home. So for me to see this decrease in consumption, of course, has a component of staying at home, but has another component of job losses. And we will see in a little bit the job losses that we have been seeing in the economy. For me, investment is like the main indicator, or the main, it's a very important indicator to show the perspectives of the economy. We started seeing decreases in investment, as you can see, for more than 16 months. So we were starting to see decreases in investment over and over and over and over again. And then, of course, the one in May was the strongest monthly drop in history, the one in April, sorry. And currently, it's at the same levels that we had in 1997. So the level of investment, and this again is mind-blowing, the level of investment that we are seeing right now is the same that we had during July 1997. So those are the decades that we are losing, that we are wasting during this crisis. So these are the months, the specific months. As you can see, these ones in reds are the continuous annual declines that we have been seeing in investment. And of course, we see the decrease that it's very attributable to the pandemic, but you can see the previous months weren't very good at all. Actually, the decrease in investment started during November 2018. Then we had an increase in January 2019, and since then we are accumulating decrease after decrease. A country of the level of development that Mexico has should have around 25% of GDP as investment. That's an indicator that we always track in Mexico Como Vamos, the think tank that I used to head, and now at IMCO. We are always looking at investment and how much it represents of GDP. We were always, since I've been working here, around 22, sometimes 23% of GDP. And actually, the large part of that is private investment, which is the darker blue. And now, for the first time since 2003, we're seeing levels lower than 20%. A country like Mexico should have around 25, as I mentioned. So being at 19.6 is very bad news. And then you can see, it's a little bit blurrier here, but the light blue, you can see how the public investment has been continually decreasing, slowly but steadily. And now we're facing the lowest levels of public investment basically ever since we have registered the number. The trade balance, of course, was very much hit during the pandemic, April, May, and in June, we saw this incredible increase. Of course, those are percentages, so we shouldn't be surprised, or we shouldn't be taken aback by this incredible increase. Of course, the increase was such because we were at incredibly low levels. And then as soon as the United States opened its manufacturing industry, we did as well. First, remember that when we decided in Mexico that the manufacturing industry was not deemed essential, we closed some sectors that were linked to the United States. Actually, the United States complained about this and said we should talk to each other and close together and open together in order to maintain the production chains. We reacted a little bit late, but we did. And when we opened those sectors, of course, the increase was shown. Of course, this increase was basically due to the automotive exports that increasing 500%. The thing that is more interesting for me from the trade balance is not the exports, but the imports. And please take a look at how the imports have been decreasing for a longer time, because since we're a manufacturing country, for us, imports basically relate to our capacity to produce. So imports are more relevant for the Mexican economy in a way than exports are. So when we started seeing this decrease, it was very worrisome for the economy. We started to have a trade surplus, which is very weird for the Mexican economy. Actually, the moments that we have had a trade surplus are the moments that we have been in crisis, in economic crisis along history. So we are seeing that exactly that, a trade surplus right now. And you can see that in June, the increase in imports wasn't as much or as high as the one in exports. So that shows the internal difficulties that we're living as an economy. This is the ETOE, which is a survey that tries to track the job market. Why I say tries to track it? Because it's not precise. The sample is much more smaller, but it gives you a very good insight of what's going on. The main difficulty here is the shrinking of the economically active population, of the labor force. Basically, these numbers that I'm putting here beside the red arrow are the changes from March to June. Those are, so it's like pre-pandemic, after pandemic. So the labor force has decreased in more than 6 million people, and many of those 6 million people have gone to the non-economically active population. That means that people are like not even looking for a job. The situation is so dire and so complicated that they're not even looking for a job. And then, as you might know, the Mexican labor market is very much divided into the formal sector and the informal sector. The formal employment, it increased a little bit. This comes from the ETOE as well, not from the National Security Institute. The formal employment has recovered a little bit from May to June, but you can see that the informal sector that was the one more severely hit is the one that is going to recover faster. It's going to recover faster, of course, because it's much more flexible. Actually, there are no rules there, no rules apply there. But as well, it's going to be poorer. Wages are lower, income is lower. So we're going to see huge problems here, huge problems in the informal sector, in the informal employment sector. This is before COVID. As you can see, this is the number of formal jobs created during each year. In Mexico, the population that comes to the labor force naturally, just by the population dynamics every year, is around 1,200,000. So in an ideal world, we should create at least 1,200,000 jobs each year. Of course, we wish those jobs were formal, and we have never done that. So these are the formal job numbers created in these years. And as you can see, the number in 2019 was the lowest in a long time. 2019 was a very bad year for job creation. And you can see what's going on right now in 2020. During the current crisis, the registry of the formal jobs registry has lost 1,117,584 formal jobs. These are jobs that are registered, that have perks, that have social service, that have health service. Those are the jobs that we want to create, and actually these are specifically the jobs that we are destroying. The perspectives are not very good. I know I was telling Duncan before that probably you would end up depressed when I finished presenting some numbers, but I mean, what can I tell you? That's the way it is. These are the expectations that Banxico, the experts at Banxico have every month, and as you can see, they're continually decreasing. The current expectations is that Mexico will decrease 10% this year. But what worries me the most is the recovery, quote unquote, for the next year. As you can see, the recovery is, I mean, it's not a recovery. If we are going to decrease, if we are going to shrink this year 10% and we're to grow 2.8 next year, that's not a recovery at all. So we're not only losing decades to the past, and what I mean is like the production that we lost, we're losing decades to the future in order to regain or to come back to the level that we had in 2019. Many years will pass if we take these numbers as valid, of course. And if we want to recover the levels that we had in 2019, at per capita levels, it would take us more than a decade. Probably in 2032, imagine that, we will be at the level that we had of GDP per capita at the end of 2019. Forget about 2018, because during 19, we also decreased. So, sorry, the expectations are not good. Of course, they're terrible for this year, but they're not good for next year. So that worries me a lot, because it's a huge drawback, not only in the economy, but in society, of course. This will come with other social unrest. We will face electoral processes next year. We will face a severe increase in poverty. We will have a fiscal strain. Next year will be, I mean, of course, this year is very complicated. Next year will be, I think, even more complicated, even if we hope that the virus is not around anymore. So that's basically what I'd like to share. Sorry for the numbers, sorry for the data, but it is what it is.
Thank you, Valeria. Yes, I am crying, and I haven't been peeling onions. So that's very sad news. And honestly, that number that we won't be back to 2019 levels until the 2030s is terrifying. Let's hope you're wrong. Okay. Not for your professional reputation.
No,
but
really,
for the good of Mexico.
I hope it too.
So let me just say that we've had a large number of questions coming in on the Q&A. So thank you very much for our active audience here. Eduardo took the lead and answered one specific question on the Sentinel question, on the Sentinel system rather. So that one has been answered in the Q&A if you want to see that one. But thank you very much for sending in that question, Carlos de la Parra. Let me put some questions to our panelists right now. And I'll throw in one of my own as well. But I'm just taking a selection here. One, which I think is a great question that's come in from Alday. I hope it's Ricardo Alday, a former friend of ours. But he asks, is there anything on the government strategy that has been done properly? And will there be a political price to pay by AMLO's government because of the faulty strategy, number of deaths, given the government's popularity, the distractions in the political and judicial agendas, and a totally absent and numbed opposition? And that goes very nicely with Ismael Aguilar's question, who said, you know, the position of the panelists about the likely consequences of the pandemic on social unrest. Now, those two questions there, which go very well together, I'm putting to you, Enrique, but Eduardo and Valeria, please feel free to jump in. For Eduardo, I've got a specific question here. which yeah, it comes from Mari Paz Alvarez, which touches on some of the points that you were talking about. What are some steps that the private sector and civil society could do to keep the government accountable and push it towards better policies? And what are some steps that the private sector and civil society could do to ameliorate the financial repercussions to come, both medium and long term? That part of the question I'll put to Valeria there. And then one question specifically for Valeria. You've answered this in your presentation about the economic recovery. You know, the question is from Yolanda Bello, which is our first question that came in. You know, is it more likely to happen in 2021 or 2022? And perhaps you know, you've answered that question very well already. But Yolanda also includes a comment here on sort of the local and international information we currently have available. How is the global economy going to impact upon the Mexican economic recovery? So let's begin with you, Enrique, answering the questions about essentially the political price to pay and the possibility of social unrest.
Yes, well, the question also included whether there was something good or something positive on the policies followed by the government. And I find that it's difficult to find one, though. But I would say that perhaps education, they did as much as they could do for this pandemic at the beginning. Now they are starting, they struck a deal with the TV stations in order to provide education through the TV. I mean, that's really very little, but I think that's at least something that they are doing. Something that they came with some agreements with the private sector, with the teachers union, and so on. So I think that's something positive. But that would be it, I think, because what the government is really bragging about is in the sense that the hospitals have not been fully overwhelmed. That's the success of the story, according to the authorities. And of course, there are many of us, I think, who believe that the death toll is a more important indicator of success, you know. But anyway, it is true. The hospitals have been able to react, but of course, but on the other hand, there are stories about people not wanting to go to the hospital. The death toll in the hospitals as of last week were that about a third, 38%, I think, 38% of those who come into hospital actually die of COVID. You know, it's a very large figure, and that's the average for the whole time. So it's a large figure. In terms of the political consequences, I think that's going to be very tough for anybody, for any government in any country, to get out of this mess well. We see that in many crises, it is only those leaders who really show empathy with the public, which really show sound measures, and who have success, who come out from the crisis, you know, well. In our case, I don't think that's going to be the case. I don't know to what extent that's going to impact on political terms, but as an economic historian, I would say that it's not going to be easy to erase this episode in economic history from the books. And the numbers are going to be just there. As Valeria says, it is what it is. And I don't think that's going to go away. So if the question is about the short-term repercussions in politics, I wouldn't know. But I think in the longer term, yes, this will have a tremendous impact. And in terms of social impact as well, it's very hard to think that no more social upheavals will occur. I think we are just beginning to see the strains, and something that has not been talked about is what lies ahead, in my view, is that the financial sector will probably be contaminated by the crisis in a few months' time. Not now, but in a few months' time, it's going to be harder. And that, if the financial sector gets contaminated, then I think the impact will spread much more rapidly than it has done so far. So I think so far they have been successful, the central bank and the banking community have been successful in containing the crisis from spreading to other sectors and to the people. But I'm afraid that that's going to be very hard to do so in the next 3-4 months. If people begin to feel, more hungry, as I was putting out there some figures, we are trying to reach some figures on consumption of foodstuffs for the next report of Signos Vitales, coming from a different source. And but the last survey from Ibero this week shows that yes, it is more the capability or the fear of not having foodstuffs is increasing in the future. So, and that's very worrisome. So I wouldn't be so optimistic about the social impact and upheavals that we could see in the country in the next several months. And because we already see them, but we will see more. That's the fear.
Thank you, Enrique. Over to you, Eduardo. This question about accountability, directly for you.
Let me try to answer 2 other questions, which are really good.
Please.
The first one is not everything is good and not everything is bad. I think you have to tease out the lessons, and not only tease them out, you have to contextualize, because things that might look as improper responses, they have a reason for being that way. And I think we have to go to the bottom, to the way things happen. So one of the things I think is very positive in the way the response has been is the way the federalist system has been tested and stressed in decision making. You have to keep in mind that in a country like Mexico, some things are very centralized, some are not. And I think what has happened is that even though the federal government has taken the national early response, it was actually up to the states to do the specific case-by-case response. We have 9 states which have openly spoken against the way the federal government has run things and taken responsibility of doing things. So I think that the way we've seen how the states were respected in terms of the response. Let me talk about the municipalities. The municipalities, interestingly, have one of the most important competencies in tackling the pandemic. It is in the Constitution, for those who know it, there's an Article 115, which actually gives the municipalities control, let's say, over local markets, the foodstuffs, which if you remember, that's where the pandemic started, in a local food market. So the municipalities are in charge of actually closing markets and keeping people from going to public spaces. And I think the way the system has worked is that the orders of government have respected their constitutional mandates and responsibilities. And that is something we have to watch more carefully. I think we need to understand how the system responded by stage, and to understand what type of responsibilities were up to each level. Then going to the question of civil society in response and the role they have played, I think not enough recognition has come to civil society in things that they have responded. Let me mention a few examples. It was Fundación Bancomer and Fundación UNAM who did an early capital raise to provide personal protective equipment to some of the doctors. I think that's very local and it has to be recognized. Keep in mind also that FunSalud brokeraged a system by which hospitals, private hospitals, could support the activity in public hospitals, so that some hospitals could become only COVID response, and some of the other, let's say, delayed care could go to private hospitals at a very subsidized rate. And I think all of you know most recently the effort that the Fundación Carlos Slim is putting in putting the risk capital for early production. So you're risking early production. The risk comes that the approval is not guaranteed yet. So the idea is start producing before the approval, but so that the time the approval comes, you have the production readily available for distribution. So I think civil society through foundations and through some support groups has done an amazing job. And I hope they get recognized and encouraged for future occasions.
Thank you, Eduardo. Valeria, whilst those questions were being answered, a bunch of comments came in that are really pertinent for you. So in addition to that question that we heard about some steps that private sector society could do to ameliorate the financial repercussions to come, we also had a question here. Well, it was actually a comment more than anything from David Kaplan, a friend of ours. He said, it's worth mentioning that although formal employment has fallen quite a lot, it's fallen less than in many other countries in Latin America. And just to get your response to that. And then from one of our board members, Jorge Suarez Vélez, we have a question here. What would be the impact of the loss of the investment grade rating? If you could speak to that in your response as well.
Yeah, many things and many comments. Of course, David is completely right, as usual, David. Regarding the job market and the labor market, David is the expert. But of course, as you might also know, the informal sector in Mexico is larger than in other countries in Latin America. So the informal sector is going to be more precarious. No, the income level of the informal sector, which will bounce back sooner, the income level will be less. And I think that we're starting to see numbers on that. The formal sector is, of course, more rigid. And there was, I don't know if the formal sector reacted to this, but at the beginning of the pandemic, at least from the morning conferences, there was a lot of pressure of the president and of the governor of Mexico City not to fire people during the pandemic. And actually, the governor of Mexico City issued a statement, which for me is very weird, that said that it was illegal to fire people during the pandemic from the formal sector. So yeah, the formal sector, there have been huge losses. Maybe they haven't been as large as the ones that have happened in other Latin American countries, but the informal sector is larger in Mexico. We have 50% of the occupied population is in the formal sector. So we have a huge duality and disparity there. I would like to mention something regarding what Yolanda Bello was asking, that is it realistic to expect tangible economic and employment recovery from 2021 in Mexico? I don't think it will happen in 2021 at all. The under governor of Banco de Mexico, Gerardo Esquivel, says it will happen in 2022. I think he's being extremely optimistic. I mean, I really hope, Duncan, that I am wrong and that everything happens and everything, recovers sooner than I am expecting. But there's a comment from Mariel that mentions that if I am assuming the adequate economic measures. No, I'm not assuming the adequate economic measures, because actually that would imply to have a crystal ball and to know what they are going to do. I have no idea what they're planning to do. Well, I have an idea of what they're planning to do, but what they're planning to do, it's just the opposite of what is needed. For example, in the energy sector. So they're planning to close and to become much more nationalistic in that regard. So I don't think it's a way to handle, I think the energy sector is not a way to handle this crisis at all. It's just a separate thing. But what they're doing, I'm not only planning to do, but they're doing currently with the energy sector, for me, it's extremely worrisome. But the numbers I'm using to give you that 2032 scenario come from the survey that Banxico does to the experts of the private sector. So the experts of the private sector, in the last survey that was presented a couple of weeks ago, mentioned a recovery for the next 10 years of 1.9% average, annual 1.9% average. 1.9% average after falling 10% is absolutely nothing. So if we take into consideration the population growth, that gives us that a full it's quote unquote full recovery to the levels that we had at December of 2019 will happen up to 2032, sometime between 2032 and 2033. That's more than a lost decade. And that's incredibly worrisome for me. What Jorge was mentioning, what will happen if we lose investment grade? I think he completely knows the answer. But if we lose investment grade, we're going to be in a much more dire situation, at least regarding the public finances, than that we are now, because the cost of indebtedness will increase heavily. Of course, the president has mentioned many times that he will not incur in more debt, but as a matter of fact, we are incurring more debt, as it is usual and as it is common in every single government. So we're facing very complicated scenario, not only for this year, the years to come are going to be very complicated as well.
Excellent. Thank you so much, Valeria. And to all our panelists, we're running out of time, but I'd like to group together a couple of questions that I'd like to put to the panel. As you know, the Mexico Institute focuses on not just Mexico, but of course the bilateral relationship with the United States. And a question from Merrick Rojo, which has come in, which is about, what do they expect to be the effect and reaction of the United States to the pandemic in Mexico? And I think that we could take this, not just for the Trump administration, but for whether it's a Trump administration 2 after November or a Biden administration. And one of our board members, Kansas City Southern, Warren Erdman, has written in from there saying, is the Mexican government prepared and able to take advantage of the desire in the United States to bring back manufacturing for the US market to North America from Asia and China in specific? These are questions which go perhaps a little bit beyond the pandemic, but I'd love to hear your comments. But my question on this is there a viable agenda for US-Mexico cooperation in the post-pandemic period? And in particular, in light of Eduardo's comments about the need to come up with really learnings from this period. One of the things that concerns me is that when I speak with US policymakers, the lessons that they're interested in learning at this point in time is how we manage the economy better during a pandemic. I want to know as a citizen, as a resident of North America, how do we prevent pandemics and how do we manage the pandemic itself much better? So anyway, I'd like to put those questions to all three of you. Maybe a quick take from each of you. Let's go in reverse order. Valeria?
Well, I don't know. What can I tell you? I don't know if there's a viable US-Mexico agenda. I think that there's always the possibility of collaborating, always. But I don't know if the next year will be, or this year, not next year, will be extremely complicated for the US, given the US elections. And then next year we will have local elections, but in half of the country, and then we have the legislative elections. So it's a pity that, this very important relationship is entangled in continuous electoral processes that will make everything much more complicated. I think that at least from the civil society point of view, there's a lot of collaboration. I would really hope to see much more collaboration at another level. I don't think we will be very able to see that. At least my perception, and again, I might be wrong, is that the Mexican government is very keen on looking at its own belly button. So everything is, focusing on Mexico and what happens in Mexico. But then again, and there is a question over there by Warren about China. I think what we are doing in Mexico, this administration is indeed looking to China. I had a conversation with the Minister of Tourism earlier this week. And at one point he mentioned that he was looking to China as an option to, make the tourist sector more attractive. And he was mentioning numbers on the Chinese tourists and how many of those millions of Chinese tourists could come to Mexico City. So China is on the mind of the current administration. I don't know how that will develop or how that will take form. I also know that the Minister of the Economy is trying to do things with China, but to take, it's in a different order of what Warren is saying, is to take advantage of the conflict between the United States and China. So they're trying to, I don't know how to say, but kind of bypass the US and establish different relationships, trade relationships with China. So they are indeed looking to China, but I don't know how that will come to an end.
Thank you, Valeria. Eduardo.
Thank you, Duncan. Let me answer with a few reflections. Number one is the US hasn't quite been the leader of best examples of how to tackle the pandemic. So I think there's a need for self-criticism and learning process together. I think that the way that both countries have behaved with the pandemic have a lot more in common than they have in differences. So I would suggest that we look elsewhere for best examples and we understand what happened here. And of course, there might be things that we can learn back and forth. But I think the process of introspective learning, I think, has to be in both countries. I think the second question, I think, can be answered with my proposal of one of the key takeaways that is going to emerge from this. And I think one of them is that strong health systems, we know they make sense because they keep population healthy. But I think we now realize that strong health systems also keep the economy healthy. Mm-hmm. And that is going to be very clear because one of the things that is going to characterize the new normality is the new levels of trust. And the new levels of trust have to do with a protective health system that identifies and responds very well to threats like the ones we've had. And I think a second takeaway, which is a corollary of this, is that you cannot think of this nationally anymore. These things don't respect the walls or the borders. What happens in the US has a lot to do with what's happening in the region. You cannot contain it within the country or the region, and you have to have a much more broader global approach to this. So I think these things are going to emerge, and we're going to have a more comprehensive response. It's been interesting to see how you have macroeconomists, the IMF, and all these institutions which had a very restricted speak, now are talking about viruses and pandemics and rate of contagion and everything. So I think this interchange of sectors and understanding the interrelations of sectors is also going to be a very important way to move forward across the bilateral relationships.
Thank you, Eduardo. Enrique, final comments here?
Oh yeah, thank you. Well, I would say that there were some pending issues in the agenda, both bilaterally and in both countries, that were halted by the pandemic. And those issues, for instance, the women's movement here in this country, or the issue of migration between the US and Mexico, the pandemic kind of froze them for a while, but they will come out again as soon as things become a bit more normal. And so those issues won't go away. They are there. And that could be, one way to start. But taking into account, I think importantly, that inequality and extreme poverty will be increasing in this country. And I think that eventually that will change in some ways the nature of the game, which is very unfortunate, because instead of looking as talking about your question about China, and instead of looking of how to take advantage of new situations, we are going to be dealing with very, very straining problems of society, not only in terms of well-being, but also in terms of these issues which have not been solved. Of course, we will have delinquency on the one hand, but we also will have these other pending problems in education, in nutrition, and so I believe that it's not these numbers that Valeria has mentioned about the next 10 years, and which I agree with, unfortunately, and I also hope I am wrong.
have a human face, which will change our way of dealing with many issues. And as Eduardo just mentioned, even the IMF is talking about virus. They were talking about inequality just before the pandemic. Now they will have to talk about inequality again because it's going to be much worse. So yes, I think there will need to be a new pact, a new social pact, and a new understanding between the US and Mexico, and within Mexico, of course. Next elections will be difficult. It will be an entry point, I think, will be crucial in many ways for the future of the country. And these conditions that we are talking about will probably have an impact there, although I cannot tell, with any certainty anything that's going to happen, but they will be influenced by that. So my feeling is that those all issues that were stopped by the pandemic will come up again, along with these other challenges that we will face in the near future, because the pandemic is going to have very long-term impact, I think.
Enrique, thank you for that, and thank you once again for trusting us with launching the Signos Vitalis project here in Washington, D.C. in the United States. It's a great pleasure to be able to collaborate with you. Thank you, Valeria and Eduardo. Both of you, of course, are advisors to Signos Vitalis, and it's great to have you sharing your knowledge here with us. To our participants, our attendees, the presentations from both Valeria and Enrique will be available on our website. And thank you very much for joining us this afternoon. It's been a fascinating conversation, and never before have I wished that our panelists were as wrong as I wish they are today. But unfortunately, I think that you're probably much closer to what's going to happen than not. So anyway, the best of luck. Please, everybody, stay safe, stay healthy, and we'll be in touch very, very soon. Good afternoon.
Thank you. Bye-bye.
Thank you very much. Bye-bye.